And back to Live on Lakeside. April is Oral Cancer Awareness Month, and Great Expressions Dental Center urges you to use diligence in making sure your hygiene and everything is in great shape.
Yes, and our first guest is going to help you do that with some great tips. Dr. Arthur Schechtman from Great Expressions Dental Center. Sir, thank you so much for coming.
Thank you for having me on.
Good to have you.
So what products should we avoid to help prevent oral cancer?
Why you smile?
Number one is tobacco products. We suggest staying away from them because they are the number one cause of oral cancer. That includes cigars, cigarettes, pipe tobacco, and chewing tobacco.
How about our diet? Are there things in our diet that we should eliminate totally, or?
We suggest limiting alcohol use. Alcohol, 3 to 4 drinks per day, can lead to twice the chance of oral cancer as compared to those that do not drink alcohol.
That's interesting. That's something I never thought about.
I've never heard that before.
Yes.
Do you mind correlate? Can you correlate the two? Like, how does alcohol potentially cause oral cancer?
Well, according to the National Cancer Institute, the alcohol actually will dry up the mucous membranes, and that can lead to dysfunction and eventually to oral cancer.
What about things like sun exposure? Because we always worry about our skin and things like that.
Well, sun is known factor for cancer. And for oral cancer, the lips are very susceptible to that. The lower lip being the most prominent of the two. We suggest using a lip balm with sunscreen in it if you're out in the sun for any prolonged period of time.
Now, let's talk about a regular dentist visit. We're all guilty of procrastinating when it comes to the dentist for whatever reason. So how can a regular dentist visit help prevent oral cancer?
Well, at Great Expressions Dental Centers, we suggest getting in every 6 months for an oral exam. And at that point, we do an oral cancer screening exam. At that point, we look for anything out of the ordinary, red, gray, white lesions, or any lumps or bumps in the mouth. And we look at the face, the neck, the cheeks, the tongue. And if there's anything out of the ordinary, we suggest following up with that.
Right. I mean, these things seem like very common sense. Would you have any signs just on your own that something was going on short of a doctor's visit, if that makes sense to you?
Well, as far as people, they should do a self-examination once a month, okay? And again, look for any lumps or bumps, any tenderness in the mouth, and anything out of the ordinary, again, red or white lesions. And if that is seen, contact your dentist immediately.
Doctor, we only have about a minute left, but it's Oral Cancer Awareness Month. So let's talk about that. I mean, how big is oral cancer? Would people be surprised at the number of people that actually do have oral cancer?
Well, according to the CDC, there's 43,000 new cases of oral cancer per year have been diagnosed. At Great Expressions, we are wearing red wristbands to signify Oral Cancer Awareness Month for the month of April. We are also donating $2,500 to the Oral Cancer Foundation, and we are sponsoring numerous walkathons throughout the country.
Well, thank you for all you're doing.
Doctor, thank you very much. If you want to learn more, please go check it out, Great Expressions Dental Centers. Give them a call at 888-764-5380 or go to greatexpressions.com. And before you text Mom, I know I should not smoke cigars. But I don't drink, so I'm 1 for 2.
Okay.
There you go.
Doctor, thank you very much for that very important information.
Thank you for having me, Michael. Holly, thank you.
Relax.
Okay.
You're good.
2 hours early. He's ready to get out of here.
This is a relaxing.
I'm not even making that up.